Fox 45 Morning News. All local, all morning.
Coming up, the summer months mean more time outdoors and everything that comes with that, including the bugs, the bee stings, the poison ivy. Good times.
We have a pediatrician right now live in our studio taking your calls about those outdoor hazards. In fact, give us a call right now, 410-481-4545, or simply send us a tweet at Fox Baltimore. You can also post your questions on our Facebook page. 7:48 is the time. You're watching Fox 45 Morning News, all local, all morning. Well, the summer months has more of us exploring the great outdoors, but with those adventures, you see it right here, comes the bug bites and, of course, the poison ivy. So how do you identify and then treat those bumps and rashes? For this week's Take Action Thursday, Dr. Cecily Santos, a pediatrician from MedStar Franklin Square Medical Center, is joining us for all those, that fine line on when you actually call you or when we can treat something at home, right?
So really, you can try your general first aid practices at home if you notice a rash on your child, especially if it's itchy. You can always put like some cortisone cream on there, or just watch for signs of infection mainly, and that's spreading redness, if they develop a fever, if there's pus oozing from the wound, or if there's increasing pain. That sort of thing is more concern for a parent to bring them into the doctor or to the emergency department.
So if you're not sure it's poison ivy or anything, is there any I guess, standard that says if it's covering more than 30% of the body or specific areas like face, genitals that you should definitely call?
It's really how it looks, for one thing. So poison ivy in particular looks more like streaks across the body where you've brushed up against the plant, and it can have blisters on that area. So if it does look like that, you can treat it as poison ivy. If, though, like you mentioned, if it covers kind of larger areas of the body, or if it starts here and then covers more of the body, including like on the face and in your private areas, then that should be more time to go into your doctor.
And then that treatment would be more like a steroids? Is that what
Typically, yeah, because sometimes when especially with poison ivy, you can have just your local reaction, but then some people react with their entire body, and so you may need some steroids to calm that down.
That's right. Let's go with the bug bites now, though. Poison ivy is hard to identify, but bug bites, they seem like they kind of worry parents a little bit more, especially when we're here in Maryland with deer ticks and we're worried about Lyme disease. So how do you know what bites you should actually call a pediatrician, or what bites you're like, all right, we got this covered, let it sit?
So if you know they've been out and there's definitely mosquitoes around and they come in with an itchy red bump, you know, for the first day or two, it's going to be a red raised area. That's just the local reaction. Again, if you see any signs of infection, so spreading redness, fever, pus, that's more cause for concern for an infection. For Lyme disease in particular, especially if you've picked a tick off your kid, then you should always have that red light on for possible Lyme disease. So ticks, there's different kinds of ticks out there, and the deer tick is what actually transmits the Lyme bacteria. And that's smaller than a dog tick, so it's like a poppy seed size. So it actually takes about 36 hours after a tick is attached to you to start transmitting the bacteria. So you have some time to pull that off, and you're sort of in a safe zone. So if you actually see a tick attached to your kid, always, you know, when they come in, just check their head, check behind their ears, underarms, everywhere. Look for any little dot of black to pull that out.
All right, well, stay with us because you're going to be answering some questions from our viewers. Any questions? In fact, if you have a question for the Dr. Cecily Santos, we will be back to take those calls about treating those bites, the rashes, any kind of questions that you have about the summer and what the kids are getting into or what you got into. If you have a question, our phone lines are open right now, 410-481-4545. You can send us a tweet at Fox Baltimore or go through our Facebook page. You're watching Fox 45 Morning News, all local, all morning. We're back with Dr. Cecily Santos, a pediatrician from MedStar Franklin Square Medical Center, and we're taking your calls about treating rashes, the bites, the cuts, anything for our Take Action Thursday. If you have a question, our phone lines are open, 410-481-4545. You can also go to Twitter, Fox Baltimore, send us a tweet, or go through our Facebook page. In fact, right now we do have Marie from White Marsh on the phone. Marie, what's your question for the doctor?
Hi, yes. Well, recently, out of the blue, I've developed bumps, and they're in an itchy form, and then all of a sudden it dries off into patches. Now, of course, I have friends trying to diagnose this, telling me it's eczema. I've never had eczema before. I recently just went and got some cortisone, because it was really itchy, and it did stop the itch. I'm just very frightened on what it could be, but it does dry off, and it's like a circle. It looks like a mosquito bite at first, but then all of a sudden it turns into a dry circular patch.
I mean, even if you've never had eczema before, you might be reacting to something new that that your skin is reacting to. So I would continue to do the hydrocortisone cream and see if and try not to itch, because sometimes if you itch someplace, then the rash can arise anew.
Okay.
So just you know, try to avoid opening up the skin and opening it up for infection. But if it does concern you, just go see your doctor, because it's really tough to diagnose without actually seeing the rash.
There are all sorts of things for
Yeah.
a dermatologist, yeah. So how long, though, should she wait before she sees the doctor?
Probably, I would give it like 2 or 3 days before seeing them.
Great. Thank you very much.
Yeah.
We appreciate it. Dr. Santos, thank you so much for coming in and
Thank you.
appreciate taking those calls. Well, coming up, a family is forced